Good evening, everyone. I, Dr. Tini Tankachin, on behalf of Gleneagles Hospitals, Mumbai, welcome you all for today's session on disc prolapse. It is my immense pleasure to welcome Dr. Harshal Bamb, who is an orthopedic spine surgeon and currently heading Department of Spine Surgery at Gleneagles Hospitals, Mumbai. He has experience of more than 10 years and he is specialized in minimally invasive and endoscopic spine surgeries as well as complex revision spine surgeries. He has a special interest in complex pediatric spinal deformity surgeries as well. After finishing his orthopedic training, he has done prestigious ASSI fellowship in Mumbai. He has further honed his skills during his international training in USA, Germany, and France. We welcome you, sir.
Thank you so much. Thank you.
So to begin with, my first question of the day is what is disc prolapse and is it same as slip disc?
A very interesting question, actually. It's an enigma for all of us. Largely, our back is comprised of multiple bones stacked over each other, called vertebrae. And in between two bones, we have something called as a disc. Now, this disc acts as a shock absorber or a spring. Now, whenever there's an injury that happens to the disc, the contents of disc can come out and they can cause nerve compression. And that is in common language called as slip disc, same as disc prolapse for us.
So what are the signs and symptoms for this?
So largely, whenever there is a disc degeneration which is happening, which can happen as early as second or third decade in our life, patients commonly experience back pain, which can be aggravated on bending forwards, lifting weight, reaching out. Sometimes coughing and sneezing can also aggravate this pain. But when the disc comes out and causes a nerve compression, it comprises of a radicular pain, a pain traveling down the leg, which is sometimes sharp, shooting, or electric sensation like pain. There also can be a tingling numbness in the feet. There very rarely can be a weakness of the foot, weakness of the leg, or loss of control of ball and bladder, but these are very rare symptoms. Yeah.
So who is more prone to disc prolapse?
So earlier we used to call it as a problem of an aging spine, but now we know it's a problem of a young and a mobile spine because the more amount of load you put on your back, you can get these situations. And largely we have to service our back. If we do not service, we are at risk. So if we are having bad posture, poor musculature, increased weight, and some at-risk postures when we are bending forward, sitting for long, these things can be leading to a major spine issues. Smoking also is a risk factor for a disc prolapse.
So just out of curiosity, as you have mentioned in weight gain, in obesity, so is it common with pregnant ladies?
So pregnant ladies are at a disadvantage because there's a differentiation of weight distribution when the child is growing in the womb. So and also their core and ab muscles are also significantly not working or not protecting their back. So because of the increased weight, bad posture which happens because of an issue that they're having, they are more prone to having back related issues. This prolapse can happen in them also. Yes.
Okay, so is it something very alarming and can it cause some permanent damage to one?
So most of the disc prolapses and radicular pains are inconspicuous. They do not cause a major issue. But when there's a significant compression of the nerve or there's a long-standing compression of the nerve, it can lead to weakness in the foot. We can lose the control of our ball and bladder, and these suggest us that the nerve is not functioning to its optimum or nerve is losing its function. And when it loses its function, it can be permanent sometimes. So that is the time you have to seek a medical help urgently.
Okay, so what are the red flags in this?
Yeah, that's what we talked about, the red flags. So when you have a long standing back pain, so back pain not getting better in 2 to 3 weeks, when you are having ball bladder dysfunction, you're losing the control of ball bladder, you're having change in the sensation in your private parts, when you're having fever, when you're having history of cancer, these are commonly named as red flags, and this is the time you should definitely consult your doctor.
So for this, is X-ray enough or do we need to go for MRI? Basically, how is it diagnosed?
So for us, clinical history is very, very important. But normally, the X-ray usually happens to be the first investigation which we do. And in X-ray, we get the general alignment and structure of the back. But when you're having a typical radicular pain or a nerve-related signs and symptoms, then X-ray is not enough. We definitely want an MRI to be done. Though I do not prefer to do it in first and second setting if nerve is okay. But if there's a nerve sign dysfunctions, nerve dysfunction signs are present, then definitely MRI is important because MRI shows you bone, disc, nerve, its alignment, and the anatomical orientation. So it is good to do an MRI when you have a nerve issues.
So, what is the best way to manage the first episode of disc prolapse?
Yeah. So a lot of us, like, there's a very, it's very nicely said that there are three kinds of people in the world: one who is having back pain, one who had back pain, and one who will have back pain. So all of us are gonna have back pain at some point in our life, and that first episode we usually get frightened. So the best treatment at that time is to bed rest. Do be curtailed in your activities. Give your body some respect your body in a way that don't do musty, basically don't overdo things, because that can lead to a major nerve compression. And it is important for us to know that at that time what you require is bed rest, some painkillers, some hot packs or cold fermentation, and that will reduce your pain in couple of days. If pain does not get better during that time, then you need to consult a doctor. The other aspect of the story is that at that time you also do not require any exercise or physiotherapy, because it is a time when your body is in protective spasm. Once that spasm improves, then we ask you to do some exercise and physiotherapy, because in long run that will be important for you.
Okay, so is it does this get suppressed with medications, or do we need to go for any surgical procedures?
uh, 95% or more patients with this problem do not require any sort of intervention from a doctor or a surgeon. Most of this are self-resolving, and you have to have some amount of discipline and lifestyle modification to make sure that this doesn't happen again and again, or you do not land up into a major surgical disaster. So it is important for us to know that 95% patients do get better without surgery, but you do require treatment. It is not that you do not require a treatment, because the part which we discuss, the disc degeneration or a disc prolapse. So disc degeneration is not reversible. It's like our eyes. Once we have a number, we'll have a number, unless and until we do a surgical treatment for that. So it never gets better. Similarly, once the disc is degenerated, it never gets better. So we are at a biomechanical disadvantage. Whenever we do overwork or overloading, this can come up. So it is important that you do good posture correction, improve the quality of your core, abs, and oblique muscles, which are protector for your back, extensor muscles, and also institute some form of endurance training: walk, cycle, swim, cross trainer, ellipticals, and also optimize your weight. Don't let weight gain happen, or have a good muscle bulk also. So both the things, you should not be much underweight and you should not be overweight. So these are basic tenets of our treatment for spine related issues or disc related issues. Yeah.
So, what are the surgical methods, and what are the risks and benefits of the same?
So when do you require surgery? That's the most important question. And it is important to know that when patients do not get better with a properly structured conservative treatment, when patients are having severe unrelenting leg pain, when patients are having nerve deficit signs, that means weakness in the foot, tingling or numbness in the foot, or loss of control of their bowel and bladder, these are the classical indication for us to offer a surgical intervention. And nowadays, we have so much of armamentarium available with us that this surgery can be done very safely and very quickly. So normally what we offer when there's a disc issue is a common term which we know: disc surgery or discectomy surgery. It can be done minimally invasive. It can be done like a minimal scar endoscopy surgery, or it can be done open surgery. As you ask me, what are the risks and benefits? So benefit is that it will take care of your radicular pain. The nerve pinch and nerve inflammation will go down immediately, but it's a surgery for you. So it's associated with some amount of risk, which are usually explained on person to person pathology dependent basis. So that's, but it's largely a safe surgery. You are immediately back to your work.
Okay, so does physiotherapy play any role in this?
There are two types of discussions that happen. Physiotherapy for a conserved patient is a treatment, wherein we try to improve our posture, muscle control, muscle tone, so that the loads on the back reduce and muscle helps to share that load. So that's a treatment. That's a good treatment, and that is what is going to stay with you for your life. When you undergo surgery, then it's called rehabilitation. To get back to your old activities, to get back to your purana wala strength, you need to have that physiotherapy or rehab to be done. So physiotherapy plays a very important and essential role in the treatment of spine surgery, spine patients.
So nowadays we all are aware about chiropracticing evolving. So does that also help in disc prolapse?
So if you see for spine, from the made in a house to the CEO of our company has some or the other treatment. So everybody and every pathy has some sort of treatment. So definitely chiropractic is also one form of treatment, and it's becoming too famous on social media, and you can see a lot
Yeah.
of videos. So I'm I'm not gonna deny that you can go to chiropractor because they help you to relieve the muscle spasm, but be aware of your problems. See how much of pain and how much of nerve dysfunction is there, and go to a person who you trust more. So chiropractor can also help you. Yes,
So how long does it take to recover?
after spine surgery.
Yes.
Uh, Usually, when there's a disc surgery, I'm gonna just talk about a plain simple disc surgery. Usually, my patients get out of the bed and walk on the day of the surgery, maybe within a couple of hours. They go home next day, and they can resume their office work or basic work as early as the end of first or second week. Though this can be different in different settings because there are different types of patients and different kind of presentations, but largely this is the truth which we follow. The early recovery after surgery, that's what we follow.
And is does this reoccur?
So spinal issues are common to recur if you do not take good care. So you do not service your back, it will give you some trouble. Like you do not service your car, it is gonna become a kabada in few days. So for your back, you have to make sure that even if you do conservative treatment or you do a surgical treatment, you have to service or maintain your back. That is, do not let your weight gain out of control. Make sure the muscle tone is optimum. Make sure that your work posture, the ergonomics, what we talk a lot about, is perfect. So sit tall, sit upright, don't bend forward, don't lift weight away from the body. Be aware when you're doing these activities. If you are doing just suddenly, then you are at risk of developing injuries. But if you're aware, oh, my back is bad, I know there's an issue in the back, and I have to tuck my tummy in and bend forwards, then you'll not land up into a major trouble. But if you do not take care of that part, you may land up into the trouble. And then there's lifestyle modification. So institutes of good sleep, good mental strength, or kind of meditations and all, they help you to curb your pain. So all this in all helps your back.
So my next question is: does this spinal surgeries, which have become a an option of treatment, does this work the same way for geriatrics also as it happens for the youngsters?
Absolutely, yes. So we have come a long way in spine surgery. Couple of decades back, the story was totally different. The treatment options were totally different. But now we have become a little more bullish in offering treatment for geriatrics as well. And for me, I'm even more aggressive in that part because I want a older person or elderly to be, mobile, independent, and be on top of his game. So if the spine problem is happening to them, we offer them both the sort of treatment. If treatment can be managed conservatively, conservative treatment is important. If there's a nerve dysfunction signs, if they're getting more disabled day by day, then we offer them surgical treatment. And for us, they have also shown equally good response. And always remember, younger patients are more demanding. Elder patients have their activities any which ways controlled or curtailed, so they also have a good result after the surgery and they can get back to their normal daily chores.
Maybe the recovery differs for both age groups.
Yes, so there are other factors which we have not discussed because this was beyond the topic, but I'll mention them at least here, that these patients will have some or the other comorbidities. They'll have some
Correct.
heart issues, lung issues, diabetes, and
Hypertension.
hypertension and everything. So these we have to manage. So whenever we are offering them a surgical treatment, we have to make sure that their fitness is optimum. We are not taking undue risks. So that's one factor. Secondly, because of the advancing age, the ability to compensate goes down. So younger patients can compensate with their muscles, their posture, and everything. The elderlies have more rigid spine. So we have to offer a little bit of a different treatment for them. Sometimes we do not need to offer them a full fixation or a fusion surgery where we are putting screws and plates in the back, and they can just get away by doing a simple decompression surgery, because the major problem at that age comes because of a nerve compression called lumbar canal stenosis. They have something called neurogenic claudication. So doing that surgery helps them in improving their walking ability. So that's one part. And thirdly, and most importantly, these patients have osteoporosis. They're having poor bone, and that goes hand in hand with poor muscle control and muscle tone. So we have to treat their osteoporosis, improve their muscle tone by giving them good supplements and activities and exercises. So all this comes into the picture when we are treating geriatrics. Yes.
Yeah. So, how can one differ the different? How can one differ the pain between sciatica and muscle cramps?
Yes, a very good question. That's a common scenario. A sciatica pain is usually along the leg. It's an electric shock-like sensation. It typically aggravates when you cough, sneeze, when you increase your abdominal pressure, or when you bend forwards or do some at-risk activities. So that's a pain which is classical, and a lot of the times this is associated with some form of paresthesia, what we call it, tingling and numbness in the feet, or pins and needles in the feet. Uh, Whereas a muscle spasm is largely localized to the back. It is predominantly on either side of the back. And that also puts you in initial phases, an acute spasm puts you in the bed. Even turning in the bed becomes difficult, or sitting up from the bed becomes difficult. So that's the difference between a muscle spasm, which is localized to the back, what we call as axial pains, whereas sciatica is an appendicular or a radicular pain. Yeah.
So, this is a question I think which everyone will have in their, have will be having in their mind.
Yeah.
As most of the youths are now into fitness,
Yeah.
many people prefer gym.
Yeah.
So, as you have mentioned about disc prolapse, so how can one prevent disc prolapse at the time of weightlifting?
Very good question. So whenever you're doing certain activities, typically free weights, squats or loaded squats, uh, and all these activities typically aggravate the load on the back. And now, why disc injuries happen? It's a normal phenomena when there's a load which is put on the back and ability to take the load. If there's a disequilibrium in that, so if your back is weaker and you're putting more loads, the entire load will go into your disc. Or when you lose posture while doing the exercise. So these are the times when these issues can happen. And when you're doing weightlifting, it is important for you to start slowly and gradually. Secondly, have somebody who supervises your posture. So I have seen Olympian weightlifters also having back injuries. Now I can't ask them to improve the quality of their muscles. They are like super stacked. But the issue happens when they lose their posture. So make sure that someone is there to look after your posture. And also, you have to work on the workhorse muscles. So before improving your abs, biceps, triceps, and legs, work on your core, abs, and obliques, because they are your workhorse muscles. They are gonna be always working, and they are gonna be the protectors of your back. So if you tone them up, you assume good posture, and have some supervision while doing some at-risk exercises, that will definitely prevent your back injuries.
That's great to know. So, is there any recent advancements in the treatment?
So a lot of things have been talked about: stem cell therapy and laser therapy and regenerative medicines, as well as a different type of ozone therapy and everything. But they have not stood the test of their time. A lot of us have refrained from going there. But what works best is, now we have come far away from a major open surgery to a keyhole surgery. Now we do all these procedures through just a small one cut or small cut, through which the endoscopes goes in, and we can do all the procedure which we were doing earlier in open surgeries. That's one advancement, that we have moved away from open to minimally invasive or tubular surgeries to an endoscopic surgery now. Secondly, earlier we used to do this by naked eyes. Now we have microscopes available, endoscopes available. So these microscopes and endoscopes greatly improve our vision. And when we are working at the nerve, we see a bal itna patla nerve as a big a pen itna mota thing, so that our magnification improves, so that we prevent those spine injuries that used to happen earlier. Thirdly, our armamentarium, the instruments and implants available to us have come a long way in their design. So that's a new advancement. And then our skill sets, because earlier the surgery used to be rare. Now, almost always every day I'm doing this surgery. So our experience of handling these tissues and doing this surgery has greatly improved. So these are current of good things that have happened to the spine surgery. Yes.
Yeah. So you have earlier mentioned about few lifestyle modifications. Now we would like to hear more about lifestyle modifications.
So when you have a spine issue, it's never going to go away. It's going to always stay with you. But as your eyes are bad and you're compensating with a spect, if your bad is back is bad and you can compensate your muscles, you're sorted. So there's certain things we have to definitely institute in our daily routine. That is a good disciplined exercise routine. You have to spend a couple of hours, maybe a half an hour at least, doing couple of exercises to service or maintain your back. That's more important. Secondly, work posture, because a lot of we have seen this during COVID at least, that the profile of patient which used to come to us have significantly changed, because that time there were a lot of work from home and sitting jobs and not getting out of the house, and they were not doing exercises also. A lot of them, a few of them really worked hard, but some of them did not do exercises, and that time we saw young patients coming to our OPD. So that was very important, that you have to make sure that your ergonomics of your work is more important. If you're having a desk job, make sure that you're not sitting long, you're not slouching, you sit tall and upright. Every 10 minutes, 15 minutes, half an hour, get up, walk around. That actually takes away that sprain related injuries to the back. Thirdly, as we talked about, improving the quality of your muscles of core, abs, obliques, extensors. These are supportive muscles. So we know that hacha is kamzor, the spine is kamzor. We have to supplement with surrounding pillars and scaffold. So it gives 360-degree support to the back. Largely, have good diet. That's something we have missed talking earlier.
Right.
So vitamin D3, calcium, B12, adequate sunrise exposure, these all contribute in a way, although they're not directly contributing to the spine health, but they're contributing to the muscle health, bone health, and that improves the quality of your spine, the ability of your body to take loads and preventing spine injuries. So diet is more important. Thirdly, we have talked about weight gain. So don't let weight go out of your hand. And fourthly, and most importantly, when you're doing certain activities or when you're assuming leisurely postures, make sure that you're not overdoing things. Like I can tell you, I've seen patients having back injuries when they're lifting weight from carousel at the airport, or when they're cleaning their feet when they're bending forwards. So whenever you do these things, you're not actually concentrating on the back, you're concentrating on the work. So if you have had this injury, so make sure that you do these things very cautiously. It's form of a holistic treatment. Adequate sleep also is important. Doing yoga, meditation also helps, because that reduces your pain threshold, or that improves your pain threshold actually. You don't feel pain as often. So all these things help for your spine health. Yes.
So as you mentioned about diet, youngsters these days consume a lot of protein powders. So does that also benefit for the health?
I think that's a question for a good nutritionist. To consume a lot of protein powder or not, that's a very different story altogether. But all of us have learned in our med schools that 1 gram per kg body weight is your protein requirement. If you're working out, the requirement might increase a little bit more. So make sure in one or the other way you're consuming that amount of protein. You can have a good balanced diet which gives you that food or that amount of protein, the requirement, or you can add or supplement with a protein powder. A good protein powder with a brand which you trust would definitely help you, because otherwise what happens is that you're working out, but that is not converting into muscle strength, because you're losing protein, you're not having adequate protein, so the muscle building doesn't happen. Actually muscles destruction happen. So for us, a good adequate diet, good protein supplementation, vitamin D3, calcium supplementation definitely is important for your muscle health, and that way spine health.
Yeah. Thank you so much, sir, for sharing your valuable insights with us on this wonderful topic. I thank all my audience for spending time with us. Stay healthy and stay tuned until our next session.
Thank you so much. Thank you everyone. Thank you.
Thank you.